Have you ever been in a doctor's office and just felt like there's something else going on? A kind of hidden force shaping the whole experience? Well, you're not wrong. There is. And today, we are pulling back the curtain on this powerful, unseen system that's coordinating your healthcare right under your nose. Let's dive in.
So, think about it for a second. What is the most important conversation that happens in healthcare? Is it you explaining your symptoms? The doctor laying out a diagnosis? We put so much weight on the words we say, but what if the most critical exchange of all is happening without a single word being spoken?
That's right. The most important conversation is very often the silent one. It's this invisible dialogue that guides decisions, that builds or breaks trust, and, it can ultimately shape the quality of care you get. And this whole thing, it actually has a name. And that name is Stigmergy. Now, I know it sounds super academic, but the idea is actually beautiful and simple. It's just coordination without talking to each other. The whole idea first came from watching insects, like termites, building these massive, complex nests. One termite leaves a little mud ball, that's the trace, and that little change to the environment stimulates the next termite to put its mud ball right there. No grand plan, no meetings, just a complex structure emerging from simple actions guided by traces left in the environment.
Okay, but here is the absolute key difference. We are not termites. For us, it's not just some automatic stimulus response thing. Human stigmergy is what researchers call a heed concept. It's not about blindly reacting. It's about mindfully paying heed to the world around you, noticing things, caring about them, and paying attention to the signals and traces others have left behind. It's a practice, not just a reflex.
All right, so let's take this big idea and bring it right into a place we all know pretty well, the doctor's office. How does this whole unseen conversation actually play out when you're sitting on that crinkly paper? Let's zoom in.
So this is the basic loop right here. You've got the agents, that's you, the patient, and your doctor. The environment is the clinic itself, and pretty much every single behavior from either of you produces some kind of trace. It leaves a mark on that environment, which then nudges or stimulates the very next action. It's this constant back-and-forth dance.
As a patient, you're leaving these traces everywhere, whether you mean to or not. Your tense body language, that little quiver in your voice, even how often you're making appointments, those are all signals. Your style of dress can be a trace. And of course, the classic doorknob question, that thing you ask just as the doctor's hand is on the doorknob, that's an incredibly powerful trace. Even bringing in stuff you found online as a trace from the digital world that the doctor now has to deal with.
But let's be clear, this is a two-way street. Providers are leaving traces that are just as powerful, maybe even more so. The white coat itself is a huge trace, right? It signals authority. The way the office is laid out, a quick glance at the clock, how a referral is written in your medical record, it all influences you. And here's a big one, a provider's personal biases or prejudices. Those act as these invisible traces that can color an entire interaction before you've even said hello.
And this is where it gets even more layered, because none of us are walking in there as a blank slate. Just look at this diagram. It shows the patient is person and the doctor is person. We're bringing our entire life histories with us. Past experiences, our culture, old traumas, these are all pre-existing traces that get activated in that room, and they shape every single thing that happens next.
Okay, so we've seen how this works between two people in a single room. Now let's zoom out and think about the insane complexity of an entire hospital.
I mean, how does it even function? You have one patient, and they might see a heart specialist, a radiologist, 5 different nurses, a lab tech, all in different parts of the building. If they had to call a meeting to coordinate every single step, the whole system would just stop. So how do they do it?
Well, Stigmergy is a huge part of the answer, and it's a very special kind of coordination. Let's look at this table. You've got articulation work. That's the planning, the scheduling meetings. Then you've got awareness. That's about noticing body language and gestures when you're physically in the same space. But Stigmergy is different. It's all about the physical traces of the work itself. Think about it. The notes in a chart, the lab results that pop up, an update in a digital record. These are the traces that allow this huge team to work together seamlessly, often without ever even seeing each other.
So this is the really exciting part. If this powerful system is already running in the background, can we actually design it to work better? Let's zoom out one last time to the level of the whole society and see how we can engineer Stigmergy for good.
Oh, absolutely we can. We can totally harness this. I mean, imagine a Yelp for doctors, where patient reviews are literally traces that guide other people to better care. Or using something called linked data to build digital worlds where different systems can coordinate care automatically. You could even have smart home sensors that notice when someone leaves and comes right back. A little stigmergic trace that might signal forgetfulness, a potential early sign of dementia. And better electronic health records? At their heart, they're just better systems for leaving and reading traces.
But this is where the story has to take a critical turn. Because Stigmergy is this incredibly powerful tool for coordination. But coordination isn't always good. What happens when the traces we leave behind and the ones we choose to follow are actually destructive?
And this connects directly to a word we all know, social stigma. When you look at it through this lens, you see social stigma for exactly what it is. It's a negative, stigmergic trace, a label, a stereotype, a certain diagnosis in a patient's chart. These can act as traces that trigger awful, biased behavior from providers, and that creates very real, very dangerous barriers to getting care.
And this right here is probably the most important thing to take away from all of this. Stigmergy itself isn't good or bad. It's just a neutral tool, like a hammer. Its impact, whether it builds something up or tears it down, depends entirely on the traces that all of us, patients, doctors, designers, choose to leave behind, and just as important, the ones we choose to pay attention to.
So, with all this power baked into the environment, what does that make the modern doctor? Well, research with both patients and doctors keeps pointing to this one powerful metaphor, the doctor as a conductor. This quote just nails it. It says, a doctor's main job isn't just to be a scientist applying biology. Their real genius is in being an interpreter, a hermeneutic, which is just a fancy word for someone who interprets signs. They have to read all the traces, the spoken words, the unspoken ones, the patient, the chart, the whole system.
And this is the final mind-bending idea. The very best doctors don't just conduct the orchestra of specialists and drugs and treatments. They conduct the concert hall. They are fundamentally shaping the environment, the context, the space in which the music of healing can even happen. They manage the traces and they tune the room, making the whole performance of care possible in the first place.
So I'll leave you with this question. The next time you walk into a clinic or really interact with any complex system, just ask yourself, what are the invisible traces guiding my actions right now? And what traces am I leaving behind for others? Because this unseen conversation is happening all around us all the time. And now you know how to listen in.